So John, if you can join me in my office, it'll be quieter in here. John, today I wanted to talk to you a little bit about physical activity. You might remember last time we met, we discussed the importance of weight loss to help improve your type 2 diabetes. Today my goal is that by the end of the session, you will safely and effectively perform a progressive aerobic exercise routine to help aid in your weight loss. What kinds of physical activity would you say you do now, John?
Nothing. I walk up and down the stairs, that's it.
Was there any type of physical activity you used to enjoy before your diabetes diagnosis?
Yeah, of course. Would walk with my wife and the dogs.
Great, well why don't we start there? I'm going to go through the handout with you here and let me know if you have any questions. So many of these points are taken right out of the Canadian Diabetes Association's website, so I really recommend you check them out. They have some wonderful resources. Alright, page 1 of the handout. Safety first. Make sure you wear comfortable, proper fitting shoes. Wear your medical alert bracelet or necklace all the time. Listen to your body. If it says you're doing too much, then make sure you stop. If you're having trouble breathing, make sure you see your doctor, alright?
Okay.
So on the next page of the handout, the chart was pulled right off the Canadian Diabetes Association's website, and it outlines a walking plan you may choose to follow to get started. As you can see, first week you'd start with 10 minutes of light walking twice a week. Eventually you'd be able to walk moderately hard for 30 minutes 4 to 5 times a week, which would be our goal for you to maintain. How does that sound?
Well, it sounds scary, but exciting. I think I can do it.
Exactly what I like to hear. Okay, now I'm going to demonstrate to you the correct way to walk, because since you'll be walking, it's important to be careful to prevent injury. We want you healthy and active for a long time. Alright, some things to remember while walking, John. If you want to make sure you're engaging your hips and glute or bum muscle when you're walking, not trying to just throw forward your legs as you walk, but instead use the back leg to push off. You want to make sure your hips do their job so you don't injure your knees or ankles. So, just like that. Some people will even practice in their houses by holding their glutes to remind them to engage that important muscle. Just make sure to do it with the blinds closed so your neighbors don't see you walking around holding your glutes. One other thing to make sure is your arm swing. You want to make sure you're throwing forward the opposite arm and the opposite leg as you walk. That arm swing is important as it helps the hips rotate as you walk.
Let me give it a try.
You give it a try. Looks pretty good, John. Good job. Alright, so remember to engage those glutes. You'll be walking those dogs around the block in no time. Alright, John, if I was your wife and you were gonna teach me how to walk safely and properly, what would you tell her?
I would tell her she needs to wear proper shoes.
Yep.
Listen to her body.
Yep.
When learning how to walk, I would tell her to start slow, progress a little bit every week. I would show her the chart in the handout, and I would show her what you showed me about walking properly to prevent injury.
Amazing. Perfect, John. Do you think you can show me that $1 million walk again? Amazing. Seems you're walking like a pro. Let's send you home and start on your plan. Week 1 starts today.
Woo!
Woohoo!